Road to Recovery is a series of video programs about mental health in Manitoba.
Well, everything comes apart, Like if you're going to school and maybe at 15 you start to develop paranoid schizophrenia or manic depressive, and you got a girlfriend, and the girlfriend thinks you're a bit nuts, so she don't want to see you no more. So you don't go to socials anymore because you think everybody else thinks you're nuts. So you drop out of school. You don't get a job. You don't go to the prom. You go to the hospital instead. So you got nobody. The only people you got are the people that are at the hospital, that are like you. And when you get out in the community, you got nobody at all. They have proctors that go around and help out, but it's hard, really hard for people.
These are our communities, places to live, work, meet new people, and enjoy company. You know, everyone's thought and talked about mental health at one time or another, whether it's their own or someone else's. What makes a difference is the diagnosis. Individuals that look for guidance are presented with support and services as they are provided by the community. Our research took us to many resources. It wasn't too surprising for us to find that what everyone really wants is what everyone really needs. It also brought us full circle to the question, what is mental health? And what is good mental health?
Mental health is a term that's used in the community for people that suffer from different illnesses, whether it's schizophrenia, manic depressive, anxiety. Mental health has been, back to probably 1961, was support for people suffering from those illnesses.
So mental health refers to health that encompasses those things that revolve around psychological or emotional well-being, and it's really something that's very much a part of our whole health. It impacts on our physical as well as our emotional well-being, and they make a distinction in health practice as having physical and mental health, and mental health, and so that's why we have a separation in the health field. We have a separation of mental and physical health, but it's really critical to the whole being. And mental health literally addresses, we need good mental health. People who have bad mental health obviously need that to be addressed. So mental health just refers to that part of the health system. So when I think of mental health, I don't think of it as something that's necessarily good or bad. We want to establish good mental health.
Good mental health is people that can do everything that everyone else can do. Get up in the morning, feel good about yourself, sleep well, have a social life, not have to worry about how you're going to get by from day to day. That's good mental health.
Good mental health is when we feel well, when we feel comfortable, when we're thriving, when we have everything in our life going relatively smoothly. I mean, it doesn't obviously mean that that there aren't bumps in the road. And good mental health doesn't necessarily refer to psychiatric diagnoses. Mental health can reflect just the regular everyday stressors in our lives that get us down. So it refers to a category of psychiatric diagnoses, but it also refers to just general problems that can have impact on our lives, that can impact ultimately on our physical well-being.
There's degrees of wellness, I think. It's some people, they stay the same all their lives. It's a waste of life. They take a lot of medication and they can't function the way other people normally do. Can they get better? It depends on how you're looking at it. If you're suffering from schizophrenia and they give you, or paranoid schizophrenia, and they give you medication that helps you, that's all of it. Or manic depressive like me, it slows you down and gives you somewhat of a normal perspective on what's going on around you. And I think that's a big part of it. The other side of mental health is what I spoke about is, if you got a job in the community and you're doing well and everybody has a certain amount of stress, doing that, children, family, a lot of patients don't have that. And that's not good mental health. If you're going to the lake for the weekend, psychiatric patient's not going to follow you. He's stuck in whatever room he's living in because he only has a certain amount of money to live on. And that is a mental problem in itself.
Yeah, I think I can identify when I have good mental health, and I have a mental health psychiatric diagnosis, which, as far as I'm concerned, is a medical problem as well. So it falls under the umbrella of mental health, but it's also part of my physical. It's also very much a part of my physical health as well.
Hi, Kathy.
Hi.
How are you?
Oh, I'm good, thanks.
Great. Kathy, a few days ago you were telling me that you had suffered from depression in the past. Mm-hmm. Can you tell us a little bit about that?
When I hit probably about my mid-40s, I went through I didn't realize I had depression. I went through a really bad time for about 6 months. I had started to lose my appetite, couldn't sleep at night. I was drawing unemployment insurance, so I wasn't bothering to leave the house. I was just isolating myself. And then when it got close to the time where my EI benefits were ending, I took my resume over to have it updated, revamped a little bit. And the person I was talking to, the counselor I was talking to, finally asked me how long I'd been suffering from depression. Like, he picked it up, and I hadn't picked it up for myself.
So what did you do then?
As soon as he said that he thought I was suffering from depression, that I should go and check with my doctor first of all. Well, I was crying in his office. As soon as he asked me that, I started to cry.
Did you? Yeah.
I realized, oh, bingo, that's the problem. And I've been around, adults my whole life that have suffered from mental illness, so I was just so surprised that I hadn't recognized it in myself. But as soon as he said it, I knew that's what it was. It was just like a tunnel, a light at the end of the tunnel.
Wow.
I went and saw my family doctor that day. Mm-hmm. I also saw that my family doctor arranged for me to see a psychiatrist same day, and they prescribed some sleeping pills for me, an antidepressant, and once I started sleeping, even after, the first week, I just started feeling better and better. After a few weeks, just back to myself, just feeling, happy and interested in being alive, and I'd lost that without even realizing it. So.
And it was just such a gradual loss that you didn't even notice it?
I didn't even notice it, no.
Yeah. You were telling me before about the first time where you went actually into the mental health services. Can you state that experience again and how that felt for you?
Okay, the psychiatrist had mentioned that I should maybe go and talk to a counselor at the mental health center in the town center there. And I really didn't want to. It was embarrassing enough going to see a psychiatrist without having to go into a public building where somebody would actually see me enter that office. So when I got to the door, I stood in the hallway and I looked both ways, make sure there was nobody in the town center that was going to see me going in there to make an appointment.
Wow, yeah. So, but that is the stigma that surrounds mental illness.
Oh yeah, it is, and it's silly looking back on it. I find that I would even do that was a very silly way to handle things, and it wouldn't bother me now to walk into the office, but at that time, it certainly did.
Yeah. One of the things that I'm glad you're talking, on film right now, is by sharing your experience, it helps to destigmatize things, because before you were very hesitant in regards to walking into that office of having somebody else see you, and here you are, you're on camera.
Yeah.
Yeah, so I really, really must thank you very, very much, because that's absolutely essential.
So I just don't want somebody to go through the same thing I did without recognizing the symptoms for such a long period of time, because it was such an easy solution once I realized what the problem was. So.
Exactly.
My name is Nora Chant, and I've been living in Brandon for quite a number of years now. I came here to go to school. I'm originally from a small town just east of here, McGregor. That's where I completed my high school. And then I came to Brandon to go to university. And at that time in my life, I was somewhat symptomatic but it was unclear what was wrong. And probably that's the first time during that first year at university where I started to seek some help, but it was very unclear about what was going on. But it was my intent to go to university, obtain a degree, and then sort of move from there and see what I could accomplish. But I decided to stay in Brandon, and my illness started to manifest itself even more.
How did your illness manifest itself?
Well, I'd always experienced a problem with what I thought was attention deficit, a little self-diagnosis there. But as it turned out, it began to resemble something, and as I began to become more aware, it began to resemble something which I came to know as a flight of ideas. So instead of having trouble staying on topic like a typical person with attention deficit disorder, my ideas were all over the map. And I was actually thinking fairly clearly about those things, but I was just all over the map. And I realized in later years that that was a type of mania, or as my doctor calls it, at least a type of hypomania. And although it didn't originally meet manic states, where I would probably would have been diagnosed earlier, but because I was able to manage and function, I just had a lot of really wild ideas, and it would lead me into some very interesting course areas, and I was constantly doing interesting things like trying to convert to Judaism, imagining all kinds of interesting things, reincarnation, and exploring all kinds of ideas. That's the kinds of things that were occurring for me, and they were disruptive and interruptive, but I still managed to go to school. And at that time, I couldn't identify it as anything other than just being a little eccentric and very excited about these ideas. So it was always somewhat manageable, but unlike anything most people would experience. And then I would have very deep clinical depressions. So I would start to drop down into these very blue moods.
You sought help and got a diagnosis. And
Many years later, mind you.
And you're taking medication and forms of therapy. What is your prognosis?
Well, that it's a chronic, recurrent, episodic illness. It'll never go away. Medication for the rest of my life. Monitor it. My doctor says I have a lot of self-awareness. Even before I was diagnosed, I knew something was wrong. Even as a kid, even my parents tell me I had considerable self-awareness. I recognized that there was something wrong, and I would work very hard at trying to manage these peculiar symptoms, reel them in, and just get to work and try to manage. So I have that kind of internal resources and strength, and it's helped me enormously. But what a struggle. It was exhausting. It was exhausting.
How did you receive a diagnosis?
It took many years to receive an official diagnosis. Now, I started experiencing symptoms when I was a little girl, but ultimately I was probably 30. I'm 45 now. I was probably 30 when I started to receive some degree of appropriate assessment. And I was probably in my mid-30s before I received that actual diagnosis. And I started seeking support and help in the mental health field when I was in my 20s. Probably before that, even when I was in the school system.
Did you seek it on your own?
I did, ultimately, yeah. I started to have experienced symptoms that were leading to what we, I guess, traditionally think of as a breakdown. It's kind of an archaic term, but I started to feel as if I wasn't able to function, and in fact that's what was happening. So I started to seek it out, and I had my doctor make some referrals, and friends started to help and support me, but that's when I got into the actual mental health system and started getting appropriate supports and a really good doctor.
Were you comfortable when you got a diagnosis?
I was relieved, actually, when I ultimately got a diagnosis, because I struggled for years not knowing what was wrong with me. When you have an illness, often when you have a psychiatric illness, especially one like bipolar illness or something more serious like schizophrenia, it manifests itself in behavioral and in psychological ways, which can be very confusing for people, and it's very easily misunderstood. And so you start to think that it's your fault, and you start to think of it as something that's mood or temperament, and it's very, very frustrating. When you get a diagnosis, for some people, it's sometimes perceived as a label, and it can be very, immobilizing. But I think for me, it was very liberating. It made me feel that, yes, I need to take responsibility for my health, but on the other hand, it relieves some of the guilt that I felt associated with some of my feelings and some of the things that I had done. And it gave me that feeling that now I can take charge, now I can do something about it. And so it had a positive impact on me.
When you decided to seek help, was it awkward? Did you feel awkward?
At times, it was frustrating. It was a long process of finding the right medications, of finding the right supports. When finally I was diagnosed, I was in the hospital, and I was introduced to a really good psychiatrist who was very determined to find the right diagnosis, very determined to work with me. He was very helpful in determining what would be the most effective medications. And medications in some cases have to be changed. You find something that works and then it needs to be changed again. It requires a real partnership between the patient and doctor.
Was there a stigma attached to you seeking help? Did you sense that?
Yes, I did. I've always felt a stigma. My friends, I have great friends, but they weren't terribly supportive. Some of them said, "You're just looking for excuses to not face the world." Some of them were supportive. Some of them work in the mental health field, so some of them thought that this was a long time coming. Yeah, there's always been a stigma. There still is to this day. Sometimes there's kind of a reverse stigma for me because some people speak to me not realizing that I'm someone with a mental illness and don't recognize that I've struggled. I've really been down at the bottom, unemployed, not knowing what to do, living in inadequate housing, being on social assistance. And I think some people don't realize or don't identify me with the stereotypical person with mental illness. But I have really hit bottom many times and not known where to turn. And I kind of resent the fact that there is this, what occurs is that there is this stereotype and that they can't recognize that people can go from being very, they can go from this position of being a real struggle and adversity and rise up from that and become something and pull themselves together. And then it's not a linear process. You know, you go along, you may relapse, go along. And so I've been the victim of stigmatization in the process of getting better, and I've been the victim of hearing these kind of negative attitudes as a result of having a certain amount of success in recovery.
Was there anything positive to hitting bottom or going through the rough times?
Well, I think so. I think there always is when you're struggling with something that has that kind of an impact on you. Sometimes you need to go down to make that realization that you have to face the reality of a long-term chronic illness that you may have to treat for the rest of your life. An illness that's frequently associated with periods of unemployment, with periods of relying on social assistance, with periods of acting bizarre. Sometimes, yes, you need to hit that bottom and rise back up.
You seem to have accepted your diagnosis and you've accepted seeking help. Have you met others that haven't?
Yes. Yes.
Is that more common?
It's quite common. And sometimes it's the nature of the illness, because some of the illnesses have a psychotic component and there's a delusional component, and sometimes it's just that fear of being part of something that's still very misunderstood. So sometimes the illness, the nature of the illness doesn't permit you to perceive the world accurately. So you stay in a phase of denial. Sometimes that's when the meds just aren't very effective or they don't take the medications. And sometimes it's just, I don't want to be a mental patient. So I do encounter that a lot.
If I hear what you're saying, there is a stigma, there always will be a stigma. Can you overcome the stigma, or is your advice simply get over with it, deal with it, and move on?
I think recognize the stigma, learn to believe in yourself as a human being, no better, no less than anyone else. Recognize that there is a stigma. I do think we can overcome it, but I see it as something, a real struggle, and something that's an ongoing fight. And we really need to educate people, and we really need to show people that that the population of people with mental illness is diverse and varied, and in most cases, people with a psychiatric illness, with the right supports in place, can experience a degree of recovery. I'm working with a group of people called the Common Cause. It consists primarily of clients, which is one of the words we like to use. It refers to people who have been through the mental health system, have a psychiatric diagnosis. It consists of service providers who are also clients and non-client service providers. And the group meets on a regular basis once a month to try and address some of these issues about stigma, to try and educate the public. We're working on a peer-to-peer support line of some kind. We hope to have that up and running within, I would think, a year, so that we provide just another alternative to people who are experiencing just any kind of general health, mental health concerns, or and they need to connect with someone who's had those sort of experiences. And we'll primarily be a support line and a source of referral. You know, I can tell you my experience and I can refer you to appropriate supports. So that's one of our big projects, is demystify, destigmatize, and refer and support.
What would you suggest to somebody who may be in that awkward phase right now of experiencing that? Seek help.
Seek help. Don't be ashamed. This is a legitimate problem. It's, in my estimation, a medical problem, even if it's occurred as a result of, even if it's something that's happened as a result of an external event, and perhaps you don't have a psychiatric diagnosis in the sense that you've developed a mental illness, but any kind of experience that has caused some trauma for you. Don't be ashamed. Find support. It's available to you. There's lots of free support. It can be done discreetly. And don't deny yourself. Find people who have had similar experiences, people who will support you and help you. And remember that it has an impact on your physical health, that is very much a part of your physical health to begin with. And don't live suffering unnecessarily.
And chances are there are many individuals with the same situation and condition as you. You just need to go out and seek them.
Seek them out, and you'll find people that, yes, have shared those experiences, has walked those walks, and you'll discover that you're not alone.
Road to Recovery is a series of programs about mental health in Manitoba. Today's program was titled Perspectives on What is Mental Health. Special thank yous today go to Doug Hayward, Nora Chant, and Kathy Rempel.